Now we'll review the abdominal muscles. And again, they're anterior to the spine, right? Because they're on the front side of our body. And so, based on line of pull, they are predominantly responsible for trunk or vertebral flexion and also right lateral bend or lateral flexion and left lateral bend and lateral flexion. So, what are the purpose of these muscles? To protect the viscera or your internal organs in the abdominal cavity, right? We have lots of important organs in there. And then again, as I said, they do trunk flexion and they also control pelvic movement. So this anterior posterior pelvic tilt that we talked about in the hip section. And so they, especially the rectus abdominis, anteriorly attaches to the pelvis, and so kind of keeps us from going into too much anterior tilt. A simplistic view of these four muscles, abdominal muscles, is that they are each aligned differently in different directions. So they create a web. So if you slice one or rupture one muscle, it's not a complete exposure of your viscera. So let's look at them in turn. So we have the transverse abdominis, deepest muscle layer. Let me get an arrow. The fibers are directed horizontally, and the function is to compress the abdomen. Next, we have the internal obliques. They're intermediate layer. They are oriented superiorly and medially, so going superiorly and medial from the lateral side. They have multiple functions: compress the abdomen, flex the trunk, lateral flexion, and importantly, rotates trunk to the same side. So internal obliques rotate ipsilaterally, I. The external oblique is the external muscle layer. The fibers are oriented at a right angle to the internal obliques. They go inferior and medially. So if this is your midline here, inferior and medially, they're similar to a coat pocket. So that's how I remember it. Pretend you're putting your hands in a pocket and that'll give you the orientation. Again, similar functions: compress the abdomen, flex the trunk, lateral flexion or lateral bend, and rotate the trunk to the opposite side. So their rotation is contralateral. Then we have the rectus abdominis. It's a strap-like muscle that's anterior, vertical fiber orientation. It has these connective aponeuroses that kind of shorten the muscle fiber, and that gives us the perceived quote-unquote six-pack between these aponeuroses, and then you have the muscle belly. You also have running superior to inferior down the center of your trunk is a longitudinal collagen partition down the center, and that is called the linea alba. If you are able to get pregnant, that line becomes very dark, and they call it the linea nigra. All right, so trunk rotation, something to remember. To rotate to the right, it takes your right internal oblique, right? Because remember, I ipsilateral, so the right internal goes to the right, I, and your left external. To rotate to the left, it takes your left internal and your right external. Other images of your abdominal muscles are shown here. The rectus is cut on one side here, showing your transverse abdominis, your linea alba that's running longitudinally, and you see your internal obliques on this side. This is a cross section here, this lower right image, so you can see the two rectus abdominis sides, and then you obviously have subcutaneous fat, and then your external oblique, your internal oblique, and your transverse abdominis. This is your rectus abdominis. You see your aponeurosis separating the muscle belly, which is basically a longitudinal strap muscle. And again, flexion of the spine because it is anterior, and ipsilaterally, it helps with lateral flexion or lateral bend. The external oblique, they run inferiorly and medially, right? Pocket muscles. And again, bilaterally, they create flexion. They're contralateral rotators, so the left external oblique rotates you right. They're ipsilateral lateral flexion or lateral bend, so the left external oblique will help with lateral bend to the left. Deep to those are your internal obliques, so they're going superiorly and medially, right? So 90 degrees from the external oblique muscle fibers alignment. And they are bilateral. They help with lumbar flexion. The ipsilaterally, they go to, so the left internal helps with the left lateral bend. And ipsilaterally, they rotate. So the left internal rotates you to the left. And in this case, sorry, this picture is showing right rotation and the right side. So right internal will rotate you to the right. And then deep to that is our transverse abdominis with horizontal fibers, and it helps compress the abdominal cavity. Okay, we're going to show axial twist in this video. And remember, external obliques are contralateral rotators. Internal obliques are ipsilateral rotators. So in this video, we are rotating to the right. So we are using our right internal and our left external obliques.